Welcome to Physician Heal Thyself, the podcast, empowering you to take a whole person approach to your well-being, spirit, soul, and body. Join me, your host, Dr. Lara, naturopathic doctor, entrepreneur, and a servant of Jesus Christ. We are not just a body, we are spirit and soul. It's time to integrate medicine and spirituality into our healing. Let's get started. Welcome back to this episode of Physician Heal Thyself, the podcast. I'm your host, Dr. Lara. I hope you enjoyed the last episode. I talked about some of my observations on what I see people not heal. And in this episode, I want to talk about some medical cases that I was just in awe. And I truly believe that it was because they were committed and they did all the things that they needed to do on their part, right? So just as a disclosure, I am not sharing any personal confidential information that would reveal who these individuals are. There's many patients. I have over, a couple thousand patients I've worked with at this point. And there's many similar cases. So I'm not going to provide any descriptors to keep them, their information personal, because it is confidential. So we're going to talk more of the case and the outcome. So this first patient presented with pretty severe arthritis in most of the joints in her hands, wrists, elbows, and knees. And so a lot of major swelling. And if you have experienced or have arthritis and have experienced this kind of pain, or you have a loved one, you can see that it's very debilitating. So a lot of swelling and a lot of pain. And this person came to see me, and immediately upon the visit, I noticed her, the joint swelling. And so I knew that I would start her immediately on my treatment, on my regimen for this particular condition. Normally with most patients, when they come on board, I do my intake assessment and then I give them lab work for them to go do and come back. But in some cases where it's clearly evident, I don't want to wait for all that to happen for us to start treatment plans. So with her, even from the first time I spoke with her on the phone, I knew I would start a treatment plan with her. So I gave her the regimen of what to do diet-wise and lifestyle-wise, and then the supplements, herbs that we were going to do to help with reduce the inflammation, the swelling. And I provided the necessary labs that I wanted her to do. And I told her, you can do these anytime, come back. She came back within 30 days. And what we saw was drastically different. She was ecstatic. She was very happy. She's like, all of the swelling is gone. The pain is gone. I have full use of my hands. I mean, this is amazing. And so we reviewed the labs, and we then treated and facilitate. We treated the things that were deficient or excess based on labs. So we tweaked the treatment plan a little bit. I said, wow, this is really great. Like, you're like 99% improved. So based on the lab work, this is what we're going to do. Keep doing what we did from the first visit, and here's the new things we're going to implement. So come back in 30 days. We'll recheck labs, and then we'll see how you're doing. A month goes by, she comes back, and progressing, no pain, no swelling. She's able to sleep better. She has more energy, just overall doing amazing. And so then I tell her, great, now you know what to do. Now in that conversation, and from the beginning, what we did specifically with diet with her, I had her do something that I do oftentimes with people who have arthritis or pain, so forth. And that was, we had to identify which nightshade foods that are high in lectins could be causing her that inflammatory process in her joints. So I gave her a list of foods to, avoid, and then introduce one food at a time. And she was able to identify which, I think there were like 2 foods. It might have been peppers or tomatoes, definitely tomatoes. She noticed that when she would eat that food or food that had tomato, she would feel her joints a little achy. And so once we identify what those foods were, I said, it might be best just for you to like not consume them or consume very little, and just know that that might happen. And so I did a whole episode on lectins and how it creates inflammation in certain people. So that's an episode that you can turn to look and learn more on. But this person, within the first 3 months, she was pretty much ready to, I didn't have to discharge her, but I told her, well, now that you know what you need to do diet-wise and lifestyle and supplements, you won't need to come see me again unless you need me for something else or you get a reactivation. I'm here to serve you at any time. And so that was it. The first month, immediate results of her implementing those dietary and also the supplements that she was taking and other lifestyle things we had her do. But within the first 3 months, her case was more than resolved. And I would even have, said that even within the first month, she was good. But we wanted to do the lab work to ensure, to quantify, to see what was excess or high. And so we worked on those values and they were normalized within the first 3 months. So this is one of those cases where I am sure she did not expect to see fast results that way, but she was just so debilitated, didn't feel well, and she was really committed. And, this person was driving several hours to come see me. So her commitment really showed up front. And so it's cases like this that it's just amazing. And I do have some before and after pictures of, her hands. I believe it was her hands that you could see the difference in just such a short time. So if you have arthritis, you have swelling, you got to take a look at the diet, because I guarantee you that if she had not made the dietary changes, she would have seen improvements with the supplements, the treatment that I put her on, but it would not have been as fast as and long term. I haven't seen this patient since I saw her, and that's been a couple years. So I know that when people don't come back to see me, it's because their problem was fixed. And so I don't take it's nothing personal. It's just, if you don't need to see a doctor, you don't need to see a doctor. And if she will, she knows where to come see me. Plus, she's not around the corner from me, so completely understand. So a successful case of someone who had major swelling and major pain, gone within 30 days. Now, this other patient, she did not come to me for this. It's a thyroid cancer case. She came to me for other reasons, but in my assessment, I palpated her thyroid and I noticed a pretty large nodule. And I had asked her, did you know you had this nodule here? And she's like, no, I didn't. I had a hard time swallowing, but I didn't think anything of it. So I sent her to do, we did all the blood work, ultrasound and the blood work for the full thyroid panel. Interestingly, the thyroid panel, all the tests on there were all normal, including we did anti-TPO and thyroglobulin, and they were all normal. And so TSH was great, T3, T4, reverse, all of it was just perfect. But the ultrasound revealed highly suspicious for thyroid cancer. And so she did not want to do a biopsy, which I completely respect. We did some other testing that checks for biomarkers. And we started treatment plan on her, including IV therapies. Initially, I do have people commit to doing these IV therapies 3 times a week, and that's the ozone with ultraviolet light radiation. So she came in 3 times a week, also to not live close by, was driving maybe 3-4 hours out of her way. But she came in every time for a couple months, and then we reduced it to once a week. And we retested, we did ultrasound and blood work, and the tumor was gone. And it was gone within the first 3 months. So just imagine how many people are having their thyroids removed because of cancer or nodules. Sometimes it's just nodules. It's not, they're benign, but they're nodules and they want them removed, or they have an enlarged thyroid gland, and so they remove them. And you might not have to. So the good thing about her is we caught this early on. It hadn't spread, and the body healed itself. We gave the body what it needed. A lot of dietary changes that she committed to. Did very great. She was just very on point, very good about her diet. That's been maybe 4 or 5 years ago. So cancer-free. And this is someone who I also told when I gave the diagnosis, don't get married and attached to the diagnosis. Don't go telling everyone. Wait till you start to see this, because it's going to go away. So there was a lot of faith in her. And I had a lot of faith in it, in the treatment and the process. And so she had a lot of faith, and she knew that the cancer would be gone. And it was gone, like I said, within the first 3 months. Once again, does this happen with every case? No. It could be for many different reasons. It could be that person's not following through on everything. It might be the severity of their case, might be too advanced. It might be, they might be exposed to something that they haven't identified and removed yet. And so, yeah, there's trauma also that hasn't been resolved, people's faith. Like I said, there's could be a lot of reasons why someone might not heal that quick, but can still heal within a decent time. Now, the next case is a case of I have several lupus cases, by the way, so many of them now, but I've had several cases where they do put it into remission. Now, when I assess for lupus, I'm doing more than the ANA test, which screens for several autoimmune conditions. I actually do a lupus panel specifically through the lab company to ensure that we're not overlooking. Because I don't know if you know this, sometimes that ANA test comes back negative, meaning there's nothing there. And in some people, that's actually a false negative. In those same people, I will run a lupus panel and it shows they have lupus. Now, lupus is a condition, not just only it's not only diagnosed just by the lab work. There has to be 4 of the 11 criteria, the lupus criteria. So there's many different systems that lupus impacts. It could be neurological, it could be cardiovascular, it could be digestive, it could be the kidney, it could be many other things, the skin, the fat cells. It affects everything, joints as well. So we have to ask several questions in each of those systems to see if there's any symptoms in those systems. And if we have 4 out of those 11, then they have lupus. Now we confirm it with the labs, and I would highly recommend doing a lupus specific panel to diagnose. It's a diagnostic lupus panel for people to really see if that's it, especially if there's a family history. Or, like I said, you have neurological symptoms, or every time you go outside, you get this malar rash on your skin, on your face, or rashes on your body from sun exposure. There's many other symptoms, but you can look online, like what is the lupus diagnostic criteria. Like I said, there's 11 main points on there. You have to have 4 of the 11. So these individuals had 4 of the 11 symptoms and were positive on the labs. And so there's several, like I said, cases. Sometimes it could be exposure to heavy metals and chemicals that are triggering the symptoms, that are triggering the lupus to be activated. So in those patients that I suspect, and I've had several, I actually see a lot of them being correlating with heavy metals. And so we have to do a detox, a proper detoxification, a chelation therapy, whether it's IV or oral chelators. And we do blood work to assess, make sure that they're getting out properly, and making sure kidney function, liver function is good. And once those metals start to come out, the symptoms start to go away. So I highly recommend that people, if they work in a certain work environment where they're exposed to chemicals or metals, that they get tested for this. because chances are they might be getting exposure in their work environment if they're working with these chemicals and so forth. You'd be surprised. I've had people who don't want to do the heavy metal testing, and if they don't want to do it, they don't want to do it, and I can't force them to do it. But oftentimes that could be a very huge area that is letting us know good information. Now, I don't do heavy metal testing just because we don't have to do it on everyone. But if through my questionnaires, if I see that there is exposures or potential exposures, that's when I recommend doing them. So the recommendation comes, with support. So this lupus patient came in, had a lot of neurological, skin, joint, cardiac issues, just not doing well. And we treated, we detoxed, we did a lot of testing, but it wasn't until we did the heavy metal testing to remove it. And it was almost like, it was about a year working with this case. And so every person's different. This one took a little bit longer. It was more chronic, and it had been going on for a long time. But when we did the heavy metal testing and so forth, we found high mercury, high lead, did the detox, and all these symptoms started to significantly improve after every year. Still in remission. This is 6-7 years ago that this person was diagnosed with lupus, and she's reversed, and she's been clear of it, still in remission the last 7 years. Other patients that I've had that they come on board with me already were diagnosed with a different doctor that they had lupus. We do the heavy metal testing, environmental testing, we do mold, we check for mold, and then we start doing the detoxing. And, like I said, I have many patients that had lupus and are several years out from once it was in remission, still in remission. So I will check their lupus panel every year as a check, part of the wellness check, to make sure that it's not been reactivated. So those cases are always nice, but honestly, on average, lupus, autoimmune conditions, it can take about a year. It can take about a year. So someone who wants to see fast results, this would be unrealistic with the lupus patient. You will see improvement with each month of treatment. But I'll tell you, autoimmune conditions, especially lupus, I've seen that, stress, chronic stress, it's a big no. It is the equivalent of eating a cheeseburger and fries and a Coke. The chronic stress will create a trigger, a flare-up in their symptoms. So I have to always treat their nervous system. There's a lot of great herbs and supplements that I give people to regulate their nervous system. And I tell them, you're gonna have to do this ongoing for the rest of your life. You should just do something for your nervous system, supplement-wise, to ensure that it's not gonna create a flare-up in the future. So it's better to prevent it than to try to deal with the flare-up once it's literally in your face. And so that could be a big trigger for flare-up, is chronic stress. The other is if they're not sleeping well. This is the other part that I will see create flare-up. So if you have lack of sleep and a lot of stress, they will get a reactivation. So I know lupus, they say lupus is forever, you can't reverse it. Well, you can't put it into remission, but you have to buy into the idea and commit. Remember, make your health a priority, and you have to commit to a lifestyle change. This is not a temporary, quick fix type of solution. You're going to have to be good about at least 85% of the time. Your diet should be pretty healthy, and doing something about the chronic stress. And once you start to feel overwhelmed and things are going on in your life, you need to come in and see me, is what I say. Let's do something for the nervous system. Let's start really attacking this before it gets out of hand. And then this flare-up is an ongoing for months. Flare-ups for a day or two are okay. Flare-ups that go on for a month or more, not okay. Especially if you've had these conditions, you know how much you suffer. You want to get ahead of it. So being proactive is really important. So many cases, guys. This next case is one of many. I treat a lot of type 2 diabetes. It's kind of my, it comes naturally to me now. When I say that it is something that is easy, it's not simple, but it is easy to turn around someone's health in type 2 diabetes. I have two cases I want to share with you. And this is the importance of holding patients accountable. Accountability is really important. It's not I'm wanting to control you. I guarantee you, I don't want you to come see me every month for the rest of your life just because I want to make money off of you. That's what some people think. But with this patient, and this was a medical professional, had very bad type 2 diabetes. A lot of stress, not eating well, oftentimes skipping meals. And when this person would eat, he would just eat a lot of crap. And drinking a lot and just unhealthy habits because he had a really, really busy work as a physician, but not an excuse, right? But that's the lifestyle he was in. So we did blood work, screened him, saw that he had really uncontrolled diabetes and other issues. And so I gave him the treatment plan, the diet. We talked about the diet. I want you to eat breakfast. I want you to have lunch. Keep it simple, have some protein and a vegetable, drink more water. And here's the treatment plan that I'm going to put you on to help the diabetes, because even though he was a physician, he didn't want to be on medication. But what's interesting is that those physicians will, put their patients on medications. I know. So I put this person on the regimen, and I gave him the lab order. He came back in a month, and I told him, okay, here's where we're at. I want to see you in a month again. Here's another lab order, and we're just going to check your hemoglobin A1C. And of course, the doctor's response was, well, you don't need to do it every month. It's 3 months. I said, yeah, that's insurance. That's standard of care in conventional medicine. But I know that hemoglobin A1C, which screens for diabetes, it does change sooner than a month. And in 30 days, I expect this number to be lower based on what I'm telling you to do. So this is going to be the way I'm going to hold you accountable to see, are you doing what you need to do? 3 months is too long for me to wait for you to come back to see if you did this or not. But 30 days, I will know if you're doing what you need to be doing. And if you're not, then we're going to have that conversation. So he agreed. He did the supplement. He took everything. 30 days, he does his blood work, comes back, we review it. Hemoglobin A1C originally was almost a 12, which is high. A normal hemoglobin A1C needs to be 5.6 and lower. Controlled diabetes is under 7. 6.4 and over is diabetic. Anything in between 5.6 and 6.4, it's considered pre-diabetes. So the starting point was, like I said, close to 12. And after a month, his hemoglobin A1C dropped in 30 days, dropped to 8.4, which is a huge change. And he felt better already. So I said, great, you're doing amazing. You're doing everything I recommended you to do. Here's another lab order. I want you to do it. And before you come back on the next visit, which is in 30 days, 4 to 6 weeks approximately, he does the blood work, comes back. And on that visit, when we look at his lab values, they are normal. It is like 5.4. From 11.8 to 8.4 30 days later, and 30 days after, he is 5.4. In 3 months, this man lowered his hemoglobin A1C to normal, reversing diabetes. Now, if he goes back to his old habits, the diabetes is going to come back, right? So this is where I tell people you need to commit to that change to sustain the change. That's real medicine. You know how many doctors I can get into fights and arguments over whether type 2 diabetes is reversible or not? No, they're going to have it for the rest of their life. No, they're not. If you do the right things, I know people are like, what did he take? What did you give him? Well, every patient's a little bit different, right? Everyone has stress, so we have to address the stressors in their life. And then there's things that like berberine and chromium and so many other herbs that can help them. And some work for most people and some don't. And we got to cater it to their needs. Every treatment plan is unique. So that's one of the many cases of type 2 diabetes that was reversed really quick. 3 months. Can you commit to 3 months and then commit to that ongoing? Like, this person didn't need to come see me. Now, someone like this, I might say, now I want to see you in 3 months. And if they're doing good, great, sustain that. Now I want to see you every 6 months to ensure that you are maintaining that. Look, there's nothing wrong in having someone hold you accountable. I know that there's areas in my life that I need someone to hold me accountable. So if you're someone that you're like, I need my doctor to hold me accountable, then you need to look for a doctor that is willing to have the courage to have the hard conversations and hold you accountable and create a system or process that works for you. I've had patients when I do extend their visits because they're doing so well, like, hey, I could see you every 6 months now. They're like, can we just keep it maybe to every 2 to 3 months? I still feel like I need that accountability part. I know myself. I've had people that are like, I would still like to come in every 4 to 6 weeks. I'm like, you can. If you feel like you still need that support, like a little crutch, that's okay. Because you're the one in the driver's seat of your health, not me. I'm just your GPS, guiding you, telling you turn left at that corner, turn right, stop, all of that. You choose to listen to it or not. And it's the people who listen to the guidance that it's like a no-brainer, right? They see improvement. I want to share this other case with you. It's also a type 2 diabetes. And I told this woman the last time I saw her, you are like my ideal patient. And she was like shocked because when this woman came in, she was falling apart. She didn't maybe present like that to her family and friends. And this is the thing about, the Latino community too, is they're so resilient, they suck it up and they don't talk about the problems. I had to kind of dig and ask a lot of questions to really get deep down into the root of it. How does she really feel? Like, don't lie to me. Like, the labs are going to reveal. So the first visit, she was like, well, I feel tired sometimes and so forth. We do the blood work. She came in because she wanted to get more help with type 2 diabetes. And we checked all the sex female hormones like I do with every patient, a full thyroid panel. We look for vitamins and cortisol and all of these insulin numbers, all these inflammatory markers. We just did a whole, assessment on her, a comprehensive one. And almost every value on there was out of balance. This woman was functioning, running on an empty tank. All of her female sex hormones were low. Thyroid was out of balance, a lot of nutrient deficiencies, super low. Cortisol wasn't even existing, okay? It was like a 1 or a 2, very, very low. And it should be close to 19.5 units in the morning, and she was like a 1. So when she came into that second visit, I told her, you're not doing well. Based on these labs, I don't even know how you work, how you're doing your household chores, things. I don't know how you're functioning. And that's when she kind of like broke down and realized like, yeah, I'm not sleeping well. I have no energy. I have to sleep. I have brain fog. I have to sleep throughout the day. I have all these hot flashes. I'm just super depressed. And I'm like, it's okay. This is going to change. You just got to do your part. You do your part and we're going to get you through this. The next month, she comes back after implementing the change, and she looks different. First of all, that's the way I know when someone's doing better. They have a different tone to their skin and life in their eyes. She was just, I'm doing so much better. I'm like, really? What's your energy? It's an 8 out of 10 now, where it was like a 2 out of 10 before. And, long story short, with this person, within, the first 30 days of being on treatment, she felt really good. But we kept working, we kept digging. And I'm telling you, after 3 months of, being consistent, she's like 98% improved. Now, the very interesting about this case is she came in for diabetes, but had a lot of other things that were out of balance. And I told her all of these other things that are out of balance are affecting this. And she was like on way too much medication to control the diabetes. I think it was like 3 or 4 of them. And so I started to assess things and wean her off. I told her, wean off. We're going to reduce this one medication and keep reducing it. In this 3-month process, we were doing this. And so then we would, okay, you don't need that medication, stop it. Now let's go to the next one. Okay, let's start reducing that one. Let's stop it. And then one of them, she's like, I feel great of everything, but the only thing that's really bothering me, I still have all of this edema, swelling in my legs. And so I'm like, let me take a look at your medications. And yep, without a doubt, one of the medications was responsible for the swelling and many of the other symptoms she was still having. So I said, you know what? We're just going to cut that all together, because based on your hemoglobin A1C, insulin numbers and all that, you don't need it. So she stopped it. And within less than a week, she reports to me the swelling and the frequent urination, all of that, like just stopped. It went away. And so I'm like, great. So we're down to just one medication and the natural supplements. And so the next time, I know we're going to be cutting down that one medication down to where she's on nothing. And the goal with something like this is to wean people off medication slowly while they're making the diet changes, the lifestyle changes, because what happens in that process is they feel better, they have more energy, more mental clarity, they can make better decisions about their diet and exercise. And so as things are improving, we're tweaking medications, we're tweaking the treatment plan. And that's the importance of seeing a doctor every month. I don't want someone to come every month and be like, I need a refill for my medication. Like, no, I don't want you to ever have a refill for any medication is the goal. And so all the medication she's on it's coming down because she's improving. She's giving her body what it needs. She's removed the obstacles, gave the body what it needs, and she's doing so great overall. And so obviously people in her life are noticing that, are complimenting her because she looks so great and she feels great. And so, that is the goal with diabetes, is meeting people where they're at and then guiding them through that journey. There are so many cases. But when I see people like this, like the ones I presented today, who are just so committed to their health because they made it a priority. Because, hey, they were in a situation where they were sick and tired of being sick and tired. And sometimes you need to get to the bottom to be able to come back up, right? And so when you are so sick and tired, it makes it difficult for you to make the right decisions. And so this is the importance of working with the right practitioner for you, the right doctor, because if that person knows how to get you out of the gutter and nurse you back, right, to health, that is the ideal relationship that you want to be with your doctor. So I hope you've enjoyed these cases. I feel so honored to work with individuals that are so committed to their health. They're not perfect. They show up sometimes very broken and debilitated, but they have that fighting spirit, right? They have that fighting spirit to do what they're told to do, to be, guided and then nursed back to health. And then after they're good, they can go live their life, and going to a doctor should not be part of your consistent routine throughout your life. It's important, but it shouldn't be a main focus in your life. And unfortunately, we have many people that as they get older, not only do they have their primary care, but now they have the cardiologist, and they have the rheumatologist, and they have the endocrinologist, and they have the gastro doctor, and then they have maybe an oncologist on board, and they have all these ologists on board. And now, in a week, it's not unusual for people who are retired of older generations to have 2-3 appointments a week. And that's just not the way to live life. So if you're young, even 60 and under, you can avoid having to have 10 doctors on call for all your different conditions. Start now, take care of yourself, but know that there are solutions to your problems. You just have to pray about it, seek them out, and commit to them. I hope these cases have inspired you to take ownership of your health and make your health a priority. Please like and share this video with someone who maybe has these conditions and they feel hopeless. Just let them know that there is hope and there's a right doctor for you to help you with these. So until next time, be blessed. Thank you for listening to Physician Heal Thyself, the podcast. If you like what you've heard, please like, share, and subscribe. Help this message reach more people who may need to hear it. Leave your comments. I want to know what you think. If you're interested in learning more about Raíces, visit our website at raicesndmedcenter.com. Until next time, be blessed.